Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Each. So today I welcome you to the last class of radiographic pathology of abdomen. Okay, that is we will be discussing the large intestines. After this we will start the most demanding one, that is the pathology, radiography pathology of thorax. So let us come to our lecture, radiography pathology of large intestines. Before that, some formalities, you know that. Okay, I won't talk much about this. So this is the book which I am referring, those who are new. Okay, you can read this book and get much better idea, much broader idea also, but this class will be sufficient. But if you want further studies, then this book is there for you. First, some normal anatomy. Normal anatomy is always important. So first of all, know this shape of this large intestine, which is like question mark. The shape of large intestine is like question mark, or there is a term Shepherd's hook. Shepherd's hook. This is the shape of large intestine in case of small animals. The large intestine has different parts. This is cecum. This C-shaped structure is a cecum. This is of dog. In case of cat, the shape is actually very short and cone shaped. They are not radiographically visible in case of cat. I have already discussed in the normal abdomen lecture. Okay, in case of dog, it is visible in radiograph. And this cecum, then the ascending colon. First, this is the left side. This is right side. This is ascending colon. This is right colonic flexure. This is transverse colon, then left colonic flexure, then the descending duodenum, then rectum, then anal canal. Okay. Now in this particular picture, you can pause this one and note down the positions of different organs related relatively to the large intestine, because it is very important. Suppose why this is important. Suppose the spleen is enlarged. Spleen is present on the right side, left side, and medial to the descending colon. Okay, so what will happen if the spleen will be enlarged? The colon, the descending colon will be pushed towards mid section, or if it is very much enlarged, then it can go up to the right side. Okay, so that is why the positioning is very important. Also the lymph nodes, we will see the lymph nodes, but regarding the spleen, suppose there is hepatomegaly. Okay, in this portion there will be liver just cranial to the transverse colon. If this portion, the liver, will be enlarged, then this transverse colon will be pushed caudally. Okay, so position of this large intestine can give you idea regarding pathology of nearby structures. So pause the video and note down the positions of the organs relatively to the large intestine. Okay. So next, some radiography. From radiography we will see the structures. First let us go to ventral dorsal, which will be very easy. So here this structure is cecum. Cecum is C-shaped and compartmentalized. In case of dog, in case of cat, it is cone shaped and not radiographically visible. And here comes the ascending colon. Next, the right colonic flexure, then the transverse colon, left colonic flexure, then the descending duodenum, descending colon, then the rectum, and the anal canal will be it will not be visible radiographically. Okay, so this is the part of large intestine. Let us see in the lateral radiograph also. Okay, note down the structures. Here will be spleen. This is spleen. Okay, so if spleen will be enlarged, then the colon will be pushed towards mid, or sometimes it may go up to right side. This is left. So this is cecum. This compartmentalized structure is cecum. Then this is the ascending colon. The transverse colon is not visible. This is the descending colon. Okay, this is descending colon. Okay, this is the normal radiographic finding. Regarding the diameter of the colon, normal. So in case of dog, the normal diameter of this colon, it should not exceed the length of L7. Length of L7, it should be less than the length of a body of L7. If the case is of cat, then it should be less than 1.3 times of L5. This is L7, L6, this is L5. So this length 1.3 times of L5 length. Okay, this is the normal finding in case of dog and cat regarding the diameter of the colon. Okay, we will see the cases of colonic impaction which may result in megacolon. In that case, this reference value will be helpful. Next, the compression radiography which can be done for the colon. Usually it is not very routinely practiced, but it can be done. Why? Because this compression radiography can increase the radiographic conspicuity of nearby structures. Like here, see the radiograph here, one radiograph in which there is some swelling here. Okay, some swelling here. It is for you, the case was of stomach pyometra in cat. Okay, but the nearby structures are actually not that conspicuous. You cannot identify the margins. When the same thing which was done after the compression radiography can be done by pressing the particular portion with a non-radio opaque material like wood or plastic. Okay, so after that this structure becomes very clear. Okay, this structure, this one is the bladder, this is descending colon. Okay, now this was the part of the uterus which was left causing stomach pyometra. This is a thing, this is pneumocolonography. I have already discussed in small intestines also some part, pneumocolonography. Okay, after that it becomes very clear. Okay, so this is compression radiography. Not usually routinely practiced, but it can be done. Then the contrast study, you know that the inherent air present in large intestine can act as a contrast agent. Apart from that, barium enema can be given. So the barium enema, for that you need 24-hour fasting. Just after fasting you have to go for the warm water enema to flush out all the fecal things that has been present in large intestine. Then almost in every cases you need a general anesthesia for doing barium enema study. Then barium suspension under room temperature it should be given. If the temperature is cold, okay, temperature is low, cold, there is a phenomenon which is known as spasm, colonic spasm there will occur. How it occurs? This is the radiography. Here is the bulb of the catheter. Okay, so when the temperature is cold, or even it happens when the narcotic drugs are given, pre-anesthetic narcotic drugs are given. So whatever, just point cranial to the bulb, there will be contractions. Okay, normally when you will do a per-rectal examination large animal also, there for certain period of time there will be contraction. Okay, so that is basically spasm. Like that there will be spasm. If you will keep it for some time, then the spasm will disappear like this. Okay, so this is spasm. Next you have to take the radiograph. Then after you have to evacuate the contrast agent. Then you can inflate with room air which will provide a double contrast. Then also you can take some radiographs for a better pathological study of large intestines. So some complications like other structure, it may complicate like perforation like that. One more thing regarding the, while pushing the barium enema, the dose rate is 7 to 15 ml per kg, but it should be pushed in small incremental doses. Okay, you have to push small amount, then take radiograph, then some amount, then take radiograph until it is fully distended. Okay, don't push it like some dose, then 10 ml per kg you decided and you pushed. Not like that. You have to give in small incremental doses. The complication can be perforation. Next, let us go to the pathologies, the diseases. First one is the colonic impaction, which may result in megacolon. When there will be colonic impaction, it may result in constipation. When they are not treated for a long time, it will result in obstipation. Till obstipation, it is reversible. If they are not treated and they are for longer time, then it can result in megacolon. Okay, it is irreversible. Once there is megacolon, it is irreversible. Then megacolon, in case of cat, it is very important in case of cat, but because in cat they are usually constipated. Okay, the constipation cases is more frequent in cats. So in case of cat, I told you the normal diameter is 1.3 times of length of L5. So if it is more than 1.5 times length of L5, then it is a case of megacolon. Next, let us see that what are the radiographic findings in megacolon. So radiographic findings, you will find the fecal ball or fecal matters which has higher radio opacity. Normally they are not of this radio opacity. Okay, so when it will stay for longer period of time, the water portion will get absorbed, resulting in increase in radio opacity. Okay, and also they look at the diameter. This is a case of dog. This is L7. Okay, this is length of, you can clearly see it is nearly triple. Okay, so this is a case of megacolon also you can say generalized term is colonic impaction. This is also a case of colonic impaction. Okay, the characteristics is the first one you can diagnose from the diameter. Second one is this radio opacity, increased radio opacity of the fecal matter that is present inside the colon. Sorry. Next disease is displacement. Displacement of, actually it is not the disease of the colon itself, but nearby structures. Like here you see what disease is this. I have already taught you in the urology section. Okay, this is the medial iliac lymph node enlargement. When the medial iliac lymph node will be enlarged, the duodenum will push ventrally. That is why I told you to remember all the structures, nearby structures, because nearby structures can affect the colon itself. So the colon will be pushed ventrally and there will be also narrowing, resulting in difficulty in passing the motion. This is a case of, can you tell what is the case? Here is the enlargement. This is prostatic enlargement. When the prostate will be enlarged, the colon will be pushed to a dorsal side and there is also narrowing. So the nearby structures, when they are enlarged, they can cause the displacement of the colon, and also there will be narrowing or resulting in difficulty in passing the stools. Next pathology is pneumatosis coli. Pneumatosis coli, it may not be clinically significant in all cases, but they are usually found then when there is infarction of intestines. Okay, so what will the radiography finding? You will find gas opacity in the wall of the colon. Okay, you can see clearly the gas opacity in the wall of the colon. This is known as pneumatosis coli. It may not be clinically significant, but if there is some intestinal disease and there are clinical symptoms, then it becomes clinically significant. Next disease is intussusception. I have already discussed intussusception in small intestines. The common sites are cecocolic junction and the ileocolic junction, where normally you will find intussusception. Intussusception is usually not found radiographically unless and until gas is present. Here the gas is present, that is why you can see the meniscus sign. This is known as meniscus sign. Okay, this meniscus sign is the symptom or the radiographic finding for intussusception. The better is you can go for the barium study. Here you can clearly see the intussusception. Okay, let us see another image. This is a ventrodorsal view. Here you can clearly see this is a case of intussusception. Okay, most common is cecocolic intussusception. Next disease we can go for is colitis. Okay, in case of colitis, the radiographic finding are mostly the mucosal defects, mucosal filling defect. In the left picture, here you can see all the parts are equally distended, but this portion is not that much of distended, and you can find the defects. Okay, so these defects are signs of colitis. This is another picture when the things are removed, the barium has been evacuated, then after taking the picture, here you see this is a normal. In just like the gastric folds or gastric rugae, you will find folds in large intestines. So these large intestine folds, these are normal, but look at this portion. Okay, these folds are not visible. It signs that the mucosa is inflamed. Okay, so that is by this you can diagnose the colitis. Next, is colonic volvulus, rotation of colon. There are some characteristic radiographic findings which you should know. The first one is you will find C-shaped distended bowel, C-shaped distended bowel in cranial abdomen, Second point, you will find the transverse colon, in mid abdomen, which is supposed to be in cranial abdomen, mid abdomen. And the cecum, third point, and the cecum you will find dorsally shifted and towards left side, which is supposed to be in the right side. So here let us see the radiograph. See, this is the C-shaped structure, C-shaped distended loop in the cranial. This is cranial, this is caudal, and this is ventrodorsal view. So in this cranial portion you can see here, and look at the cecums, the C-shaped and compartmentalized structure which is present dorsally. Here this is the extension, here is the cecum, and look, this is the ascending colon, this is the transverse colon. Transverse colon is present in mid abdomen, it should be present in the cranial abdomen. Then the descending colon. Okay, let us see in the ventrodorsal view. See, here is the cecum. Okay, cecum should be in right side, it should be in right side, but it has been shifted to left side due to rotation. This is descending colon. Okay, and let us see the barium study of this particular case. This is the barium study. After giving the barium, you see barium. Okay, there is, you see pointing of the barium. Okay, it means some rotation. Here is fracture intestine, this is C-shaped. Okay, this is intestine in the cranial abdomen, and here you see, you can clearly see the rotation. Okay, this is the rotation. Okay, this is colonic rotation, which you can do, you can identify from the radiograph. Next disease of the colon is colonic polyp. In case of humans, if you have gone through any colonoscopy, you will see some polyp structures, mostly due to our feeding habits, humans. Okay, so here what is the radiography finding in case of dog and cat? You will find filling defects. Okay, just like gastric polyp, I have already discussed gastric polyp in stomach section. So you will find filling defects. Okay, you can see these filling defects. Okay, they are basically the colonic polyps. The last disease is stricture, colonic stricture. It is nothing new. You can do contrast study and you can see there is stricture of the colon. Okay, there is stricture of the colon. So this is basically the radiography pathology of colon. Usually nowadays in small animal practice, endoscopy has replaced this radiography for colon examination, because in the study is colonoscopy. Okay, so that is a better diagnostic feature for doing the mucosa study, but radiography has, survey radiography specifically has some still value regarding the positioning, regarding the distance, and all those things can be better evaluated in radiography. And also you can do ultrasonography, but the air present in the large intestine mostly to contain air, it may limit the scope of ultrasonography, but specifically the mucosal thickness and wall thickness, those are better evaluated in ultrasonography. Okay, so this is all about the radiography pathology of large intestine and also the radiography pathology of the abdomen. So next class we will go for the radiography pathology of thorax. So till then, tata, bye bye, take care.